everybody. Good afternoon. Good afternoon. Good afternoon. Thank you for joining. Hi everyone. Yeah. Hello. Hi Dominic. Okay. So let's just wait for us to get to an okay number and then we can start. So if you're joining today, it's because you're interested in finding out how you can transition from any background whatsoever into health. Justice, thank you. Any background whatsoever into health. So we'll just give it a quick moment for people to join, because I have a lot of things to say today, and most of these things I would like to not repeat myself over and over, and then give the opportunity for people to ask questions. So I would like to know that we have a healthy number of people who we can start with. Yeah, so if you see me looking left or right, is because I have my notepad here where I've jotted a couple of things I want to share with you, and then I have my laptop here where I also have a couple of things that I'm going to be using today on this live. So just in case you see me looking around, is because I'm trying to give you as accurate information as possible. So one of the most asked questions, I haven't introduced myself. Okay, my name is Roseline. Sorry guys, my name is Roseline, and I'm sure you guys, if you're regular with us, you must have seen me at least once or twice. But if you haven't seen me, my name is Roseline and I work with Nexi, mostly in the marketing and visa department. So if you have questions within that area, those are areas where I can actually give you answers, right? So today I'm going to be talking about careers. A lot of people that come to us want to find out how can they switch into health. Now, why would you want to switch into health if you've not gotten a health background in the first place? Well, because there's this notion that health is a lucrative background. There are lots of job opportunities, especially if you want to move into the first world countries. These are areas that you can use to transition into having a good job and stabilizing yourself when you land. And it is the truth, right? I'm not just going to lie. Health and IT, they are killers in terms of transitioning from a third world country like Nigeria into a first world country like the UK, US, Canada, Ireland, Australia, Europe, Germany. So there are lots and lots and lots of opportunities in the healthcare space. And what makes it even more, how will I put it, enticing, is that every single day there are lots of vacancies that are coming up, both for pre-existing roles and for new roles that are just coming up. So there's a lot of gap. Let me just tell you, there's a lot and lot of gap. So these first world countries, especially with the pandemic that just concluded and we're still reeling from the effect, opened up their eyes to the fact that they had a lot of gaps. So a lot of new roles came about, and then a lot of vacancies for pre-existing roles also came about, and they're opening up their borders to people who can legally move to their country to take up these roles. And this is why most of the questions that we get asked when people come in for counseling is, oh, I want to go for a medical course, I want to go into healthcare. You're coming, you read Yoruba or Agric is even sciences, let me see, maybe international studies, and you're telling me you want to go for a master's in nursing. Who do you want to choke injection? Who do you want to kill? You just can't, you can't jump into, you just can't jump from a non-medical background into such clinical roles. But there are lots and lots and lots of roles that you can actually go into even without a background in medicine, or sorry, a background in medical sciences. right? And if you so wish to want to go into, say, like nursing or a more medical background, then you might have to dedicate a couple of years, to want to train. And I tell you, it's actually a very rewarding thing if you do that, because you're set for life. Now, what are the key things that one would want to use in making a decision to switch into healthcare? It's ever expanding. There's never going to be a time where there will not be need for healthcare practitioners in different fields. There's never going to be a time. We will always get sick. We will always need healthcare services. We will always need emergency care. We will always need technology in health. We will always need medicine. There is not going to be a time, right, where we will not need medicine. So it's an ever expanding sector, and opportunities abound, so you will never get it wrong. Then there's also job security. Why do I say so? Because of limited amount of people with the technical or theoretical or knowledge about this particular field, you are more secure in your job. And even if you lose your job in one establishment, it's easy to pick up another one in another establishment. So you are always useful. You're always relevant, in the society. And another thing, you have international appeal. So if you have a qualification or experience in certain fields, you appeal to multiple organizations across international boundaries. So you can be a nurse in the UK and you're qualified to work in the US, you're qualified to work in Canada, you're qualified to work in Ireland, Australia, Germany. So all you need to do is look for what to use to make the switch, and then you can easily just switch. Now, this is not so for a whole lot of other career fields where you need to probably start from scratch. They don't take into account your experience. Just for instance, you've been in the financial sector in Nigeria, you just can't switch into the financial sector in the UK. It doesn't work like that, because they have different things that they do. So you probably not need to start from scratch. But when you're talking about medical professions, you might not need to start from the bottom. You might actually start from mid-level and then you move up like that. So it has international appeal. So if you're here and you currently do not have any background in IT, so I'm going to be telling you what sectors are in IT, so that you don't feel like you are not qualified, right? So what most people think is that, sorry, did I say IT? Sorry, healthcare. What most people think is that once you want to go into health, you need to be maybe a lab technician, a nurse, a doctor, a dentist, a surgeon. My dear, you cannot get that kind of job without dedicating years and years of study, right? To become a doctor, you probably dedicate minimum of 6 to 7 years. To become a registered nurse, you dedicate a minimum of 3 years. To become a lab tech, dedicate a minimum of 3 to 4 years, depending on the country where you're studying. So if you don't have that time, and maybe the age is not on your side, there are other areas in health that you can actually transition into that will take you a couple of months or a year or two, depending on which particular field and the requirements that they actually want. So I'm going to be talking about the different sectors, and then I'm going to be telling you, okay, what opportunities exist. Now, please bear in mind, I'm not going to be mentioning maybe salaries or maybe particular job roles as such, because there's no time for us to go in depth. I just want to open your eyes to the opportunities and answer your questions. If you have more questions, you can always reach out to us and we can help you clarify, or you can Google, right? Okay, so in the health sector, we have clinical services. Now, for clinical services, we have hospitals, dental clinics, eye clinics and things like that, right? Then we have other health services, which are like, places where you can go for physiotherapy, occupational therapy, massage, acupuncture, hydrotherapy. These are people who provide medical services for ailments, for well-being, and the likes. Now, in most cases, for these people, they need to have years and years of training, to be able to function in this role. However, I'm still going to come to this, because even if you're operating a hospital, you still need admin staff, you still need assistants in other areas, you still need marketers and stuff. So, but for clinical services, if you do not dedicate the amount of years it takes to actually study, you will not be able to transition into this without dedication. Now we also have the manufacturing. In healthcare, when you're thinking healthcare as a whole, once you think clinical services, you also need to talk about the manufacturing industries. Now these are people who manufacture drugs, which is pharmaceutical companies, and then people who manufacture equipment. So the equipment, hospital equipment that are used in health facilities, the technology that are used in health facilities, and even the softwares that are used, in maybe managing healthcare facilities. So these are people who dedicate themselves to serving the healthcare industry, and this industry is big, and this is where a lot of people can actually come in and function in, because there are lots of roles here that do not necessarily require you to have medical degrees. Then we now have the health related support services, which are either governmental organizations or private organizations that provide health related services such as insurance. So maybe people who provide insurance or disseminate public information about health and things like that. Those are healthcare services that they are rendered to people. These are also people that are within the healthcare space. So you can also function within this space without having a medical degree. Now, so how can you come in here? Now, if you want to come in, you need to think about, you need to think about, coming in other areas that are not plain medical. So one area is the administrative role. There are lots and lots and lots of administrative roles that people can take up in hospitals, in clinics, in pharmaceutical companies, in biotech companies, in insurance companies. These are roles that do not require you to have medical degrees. However, it might require you to have some experience or certain qualifications or knowledge about medical services, and these are things you can easily get by taking 1 or 2 courses, volunteering somewhere, and stuff like that. So for instance, if you have always been in the finance sector, in say maybe a bank, you can actually transition into an insurance company or health insurance company, or even a pharmaceutical company, or even a hospital, because they definitely have the finance department, right? And there are things you can do to help you make this transition. So for instance, if you're going to a country that probably will require some sort of certification or some sort of experience or something from you to be able to make this transition, what you can do is to look for courses that can help you do this. So for instance, you've been in management in a non-health related industry, you can take a course like global health management, right? You can take a course like health management, health leadership, right? You can take a course like healthcare innovation. So by the time you're taking a master's with your wealth of experience, and then you're bringing this experience into management in healthcare, it can help you make that switch into a healthcare related industry, be it in health services, be it in clinical services, be it in the manufacturing services. So that's one way to look at it. So there are lots and lots of jobs in this role, lots and lots of jobs. So in HR, in marketing, in admin, front desk role, liaison. Hospitals have to liaison with insurance companies, so you might actually be working for the hospital, liaisoning or communicating with the insurance companies, or you're working with insurance managing hospitals. So these are roles that do not need you to have medical backgrounds. They just need you to have specialized knowledge about that particular role or that particular field, and you can fit into the medical space. And I tell you, these are really highly specialized roles. If you are able to build yourself within this space, you can never go out of a job, because they are limited. People with that knowledge are limited. For instance, if you work for a manufacturing company that manufactures health medical equipment, and you have grown in the ranks, and you have the knowledge about the equipment and all, and then hospitals who need these services, who can compete with you with the knowledge that you have? and your ability to convince hospitals or medical places to be able to actually purchase this medical equipment. You know, so you would always be relevant in the job market across countries, not just within a particular country. Do you get? So that's one way to look at it. Then another way is to also look at the tech bit. Now, good afternoon, Emeka William. If you are in love with tech or you're looking at tech, now I said the most the fields that are growing the most right now all over the world, that has just exploded since Corona, is health and tech, right? Now, so imagine if you can actually combine health and tech. Just imagine, like, I'm already jealous of you if you're actually thinking in this manner, like, because this is an area that's currently exploding. Now, during the Corona, we saw that there were a lot of things that the world was not prepared for, and tech was able to. Okay, so I'll get to your question, Ima, once I am done. How can in Nigeria switch to healthcare from any other field? Okay, I'll specify Nigeria. What I'm specifying really is about when you want to actually move into another country using health, because that's what most people come to us for. But if you're thinking of making the switch within Nigeria, yes, you can actually do that within Nigeria. It might not be as lucrative, because, you know, they don't value our healthcare professionals as much in Nigeria as they do, you know, in the first world countries. But what I'm saying applies to, you know, wherever you are. Do you get? So, but when I'm done with this presentation, I'm going to actually answer your question in detail. So, well, please stay tuned so that you don't miss out when I'm answering this particular question. So what was I saying? So yeah, so during the Corona, you know, we saw that there were a lot of things that, you know, we got wrong. People were not prepared for the amount of you know, crisis, the level of people that needed care, you know, technology to actually get care to them without having the without, you know, getting infected, you know, how to segregate people, how to disseminate information to every corner of the earth so that we can actually end the pandemic, you know, things like that. So technology came into play. There's always been technology, obviously, but technology came into play in full force, because we now saw that there was now more need. I don't know if you guys, you know, you're conversant maybe with even Instagram, you know, you will see some things, some innovations that came up during this period, where you have machines delivering medicines, machines delivering samples, you know, or delivering orders, food, you know, things like that, just to limit contact and things like that. It was people that sat down and did it, right? You know, there are people behind the scenes, you know, developing softwares, applications that can help people for different purposes, right? There are people, these are people that sat down behind the scenes to think about it. So if you are thinking of going into medical tech, that's one area that has exploded and has a lot of funding. So there are lots of startups, you know, coming up with different innovative ideas, and they also need people with the technical know-how to be able to produce the ideas that they're coming up with. So if you want to take up a role, if you need that software, or, you know, technical, like maybe hardware, you know how to, you know, couple machines or technician or whatever like that, these are areas that you can really function in, and, you know, it's something that you can do, you know, with the mindset that you are able to use your what they call it, your skills almost in any sector. Do you get? So if you say you wanted to go into data analysis or cybersecurity, or you want to code, or you want to go into engineering, you can go into medical engineering. You can go to cybersecurity in the hospital space to help people to maintain data privacy, you know, or how to help hospitals to be less susceptible to hackings and things like that. So there are lots and lots of things that you can do within the tech space in the medical sector. So if you're thinking within that angle, there are lots of opportunities and currently lots of jobs within that space. So this is something that you can think, you can want to do more research on it, and you can contact us if you want to look at specific courses that take into account IT and health, you know, together. So another one you can go for is clinical services. So for people who probably have had previous medical background, so maybe you read chemical engineering, chemistry, biochemistry, biology, or something like that. And then you know how Nigeria is now. After you finished reading, you came out and you started working in a bank, or you're working in an insurance company or something like that, and you worked for 8 years. You've practically forgotten everything that you were taught, right? Now, if you want to now make the switch back into health, you have the opportunity to do so, right? So you can think of maybe taking up a master's in a related course. So maybe a master's in chemistry or biochemistry or biomedical health or something like that. Now, because you already have a background, you are able to take up a master's within this role. And if you're doing this in maybe the UK, US, wherever country you decide to do it, it will help you to now get a job within this space. Like I said, in the clinical space, you need experience, right? Sorry, you need years of what do you call it? Years of study, right? But if you haven't also worked within the field in a long time, you might need to, you know, increase your qualifications to be able to break into that field. So let's say having a master's within maybe something related to your course that you have left for a couple of years can then launch you into that space. So you can now maybe decide you want to work in a hospital, in the lab, you know, work in, you know, other related healthcare services, you know, in other medical related roles, right? So that gives you the opportunity because you do not have related experience. So if you have a related educational background, you can choose to further your study in a country like UK and then use that to transition into a medical field. Another thing is you can actually now make a switch into nursing, right? So with an experience in a health related course, you can then do an abridged nursing course that rather than it taking you 3 years, such like adult nursing or mental health nursing, to now take you 2 years. So you can dedicate 2 years and you will become a nurse. And you all know that nursing is one of the most rewarding careers ever. Might be a career that is really demanding, especially if you are family oriented. You might not have the kind of time and space to accommodate your family, you know, but it's a very rewarding career in the developed world. So if you are looking at going for nursing, a science related course can help you transition into it. Now, if you're coming from no background whatsoever and your mind is made up that it is nursing, you now want to be able to treat people, you now want to be able to work in that medical space, you have decided that that's what you want to do, then you can actually take up a bachelor's degree in nursing. It will take you 3 years, but you must have, you know, your A-levels. You must have your maths, English, and science courses. So you might need to write WAEC, or, you know, look for, you know, related experience or courses that you can write that can help you actually get admission into a nursing program, right? So you can actually do that and dedicate 3 years into that. That is for nursing. For other courses, it might not be so easy, because if you want to be a dentist, you want to be an optometrist and stuff like that, you have to dedicate years. And I don't think this conversation that we're having is for you to go and spend four years and above in school just to get a particular degree, right? So that's for clinical services. So allied health, having MSc science background in Nigeria can switch to health courses in UK universities. Yes, I'm going to answer this, but yes, with related experience, you should be able to. So when I'm done with this, I'm going to please answer your question. So allied health are just like what the name is, like things that are aligned with healthcare, such as occupational therapy, acupuncture, hydrotherapy, physiotherapist, you know, speech therapists, music therapists, people that help beyond the hospital. So for instance, you've been through a very terrible accident, your leg is broken, but you've been discharged from the hospital. Nothing a doctor can do for you again. He's there attending to other people that have more critical cases. Now you can be moved to an occupational therapist or a physiotherapist. somebody that can actually help you to regain your mobility, right? So these are people that work alongside medical practitioners, but not necessarily in their space. So they might have their own practice, they might have connections, but they are not really in the clinical services. So those are allied occupations. Now for people like this, you also need to have years of experience. However, the good thing is there are lots of assistantship roles that do not require a lot of years of experience. So for instance, you can be an occupational therapist assistant, or physiotherapy assistant, or speech therapy assistant, and these are things that will take you probably a couple of months to a year to practice, right? So for instance, if you go to study in the UK or anywhere and you want to transition, but even if you're not studying a health related course, you can actually take some short courses, volunteer in places where they actually do these things, and then use that to transition into working for people within this particular industry. And I tell you, their pays are really, 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 really good, very, very good, because it's more hands-on, it's more of practical. They are very hands-on people, practical, so they might not be necessarily interested in you having that degree because you're not a certified person. But since you're working in an assistant role, it's easy for you to gain entrance into it and actually earn a lot of money. So those are areas you can actually also think of, especially if you're a very physical person, or say maybe in speech, maybe you're very patient now, you want to work with people who lost their speech ability due to stroke, or children who are not able to speak well, or have a lisp, or issues with their tongue, or stuff like that. You want to help to correct. You don't necessarily have to go to school for that. You might actually take courses, intern, serve under someone, and eventually be able to practice. So maybe get certified by one or two bodies. That might take you a couple of months or years, but you can be working during that period. So that's an area that you can actually look into. Then there are also support services. So support services are other services that support the healthcare sector. So maybe like logistics now, or paramedical services. You do know that you can actually be a paramedic without actually having certification, without actually having university degree, right? You can actually be one. You just need a couple of certifications, and those certifications can then help you to launch yourself into being a paramedic, and they actually earn pretty well. But you need to be physically fit, right? Physically fit, no first aid and things like that. You're gonna get training, yeah, but it's a field that do not require you to actually go to a formal university to get a degree in. So these are just things that you can train in and get certifications in, and you'll be able to launch yourself into this particular space. Yeah, so now, so what I'm going to now talk about, so basically what I have spoken about really is just to basically open your eyes to the fact that even if you want to go into health without a background, there are several areas in health that you can consider. Some will require a master's or a PGD or some sort of degree for a year or two for you to launch yourself into it. Some only require a short course, and then get an entry-level job, and then you grow from there and then get certification. So it is possible for you to actually get into this regardless of where you are coming from, especially if you want to go through study. So I'm going to be mentioning some courses, some roles that you can actually get into without having a degree, right? So say you're going to the UK, or you're going to US or wherever, and you are going for a particular course that might not be related, but you want to work in a medical field because you feel like it is rewarding, especially when it comes to the pay and job security. I'm going to be mentioning some job roles that you can actually think of, and then probably start gathering knowledge in by taking some short courses online. So things like pharmacy technician, so people that dispense drugs, people that look at your prescription, making sure that prescription is right, take inventory of medicines that arrive at the pharmacy and things like that. These are roles that do not require you to be a pharmacist. It just requires you to have some specialized knowledge that you can actually gain, and this is a role that you can actually get with certain courses that you take and it's actually rewarding. So a pharmacy technician is something that you want to actually look at. Dental technician, these are people who work with dentists, also help them with running around, maybe when they are doing dental surgery and things like that. You're helping them with equipment, assisting with documentation, assisting with things that a dentist would naturally not be able to do because he is busy doing all the, you know, the main things. You now have to do the smaller things that are actually equally important. So a phlebotomist, these are people who draw blood. So you draw blood, you label, you sort them and make sure that they arrive at the lab the way they're supposed to be. You know, you probably get information from the lab technician and things like that. So these are people who, you know, with little training, little specialized training, you're trained on how to actually draw blood, and you can work in different settings. So it might be a clinical setting, rather like a hospital or a small clinic, or just a dental clinic or something like that. So you can work in a varied amount of places. So healthcare assistants, this is the one that has blown up everywhere, because currently in the UK they are looking for healthcare workers, healthcare assistants, people that will work in care homes, you know, give care to the needy, the old, people with disabilities, people with mental illness, things like that. So this is an area that, even without you going through study, currently, at least I know in the UK, you can actually get a job from Nigeria using the healthcare assistant route. Now with healthcare assistants, you really do not need to have a degree. You do not need to have specific certifications, but it does help, you know. So you can actually launch yourself into this particular role with very little training, or even none, because most times the organization is willing to train you, because you probably be working in a care home, you know, a caregiver home for old people, and also they teach you how to actually give care, specialized care, depending on the setting, right? So this is something you might want to think about. Actually, this is something a lot of people think about, and this is something a lot of people do when they get to the UK, but they don't just know that there are other options. So if you don't want to work in healthcare assistant, let's say you're working with old people now, and you are not very keen on packing sheets and things like that, you might want to look at these other options that I am talking about, because they will require a bit more dedication to learning on your part. But if you learn, you are able to transition into them more easily, right? So medical clerk, this is something that doesn't necessarily require you to have a degree. Now if you have a BSc coming from Nigeria, obviously you already have a degree. Now if you have experience working in administrative roles, then it's easy for you to transition into this place, because what do? You're basically an admin person, basically a front desk person. You're helping in filing, you're helping in retrieving documents, you're helping in sorting information for doctors, for nurses, and even for patients, you know, retrieving files and stuff like that. So you're very hands-on and very needed, because without you, the hospital is nothing. Like, you are the one that actually knows where everything is, and you're able to bring it together. So this is an area that you might want to think of, and it's a good starting point for you to now move up the ranks, especially if you're looking at the administrative angle of healthcare. So say you're going to read something like healthcare management. Now if you start from something like that, it gives you that first-hand experience. By the time you're done with your masters, you can move up the ranks into like a hospital coordinator or stuff like that, or maybe in the HR or even the marketing department. So you can be a physiotherapy assistant, like I was saying before, in allied health. You can actually assist within this space. You do not have to actually have a formal degree, so you can take up courses and then volunteer, and then with volunteering experience you can actually get a job within the space, helping with maybe machineries, helping with assisting the clients when they are working with their physiotherapists, helping with moving them, getting them certain information, taking down information, retrieving information and things like that. That's what they do. So you can actually think of that. Another one is medical equipment technician. So you, like I said, in medical IT, in healthcare tech, there are lots and lots of equipment that are just springing up. So there was a hospital I was using, And initially, when I was in this hospital a couple of years ago, I had a file. When I go there, I bring out my card, they give me they find my file, and then, you know, with the file they pass it to the doctor, and then the doctor uses it, writes blah 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 blah. And then one day I go to the hospital and there's nothing like that, and they say we should pay for card. Now I now have a digital card. Everything is online. There is no paper trail, no paper. So everything you do, even when you go to the hospital lab to do your test, you don't even see anything. They just send your test to your file, your profile, and your doctor gets to see it, right? So that's technology and that's advancement, right? So there are people who handle, that's basically for software anyways. So there are companies who would need people who understand these softwares to train people. You know, say they have onboarded a particular hospital who has gotten their software. Now they need someone to go and train them how to use it. But more than that, medical equipment technicians are people who work within the hospital, managing or handling complex machineries, so helping with using them on patients or assisting lab technicians and doctors in handling this equipment. So it can be on both cases. So you might actually be handling physical equipment, or you can be managing softwares for companies that actually use the softwares for their medical services. So that's something that you might want to look at. Medical transcriptionist. I didn't even, when I was making research for this particular video, I didn't even know that that was actually something that was possible. This is why research is good, because if you're someone like me, I don't know if you have noticed, I like to talk, right? And while I like to talk, I also like to write. So I like to write and I like to talk. So if I wanted to actually go into the medical field, I think this is one area that I would actually think of going into. Why? Because basically you're transcribing, right? You're transcribing audio to written texts and probably vice versa, so that it can be better managed within the institution or organization that you're dealing with. So if they want it transcribed and filed and uploaded or whatever, you are doing that. And for some reason, this is actually a very a field that is growing with a lot of shortages, and the pay is lucrative. Do you get? So, and then it's not even only restricted to the medical field. A lot of fields are now needing people within this space, because all of a sudden there's just too much documents to transcribe, too much documents to work on, and they're needing people with specific skill sets that can use the technology and also have the knowledge or technical know-how to be able to do these things. So if I were thinking of moving into healthcare, maybe this is something that I might actually be looking at, and short courses and some trainings, and you already launched yourself into this particular career. So you see that you just have to open yourself up to the possibilities. Yeah. Medical secretary. So you can work as a secretary for a hospital or a specialist, right? If you know about the healthcare system in most first world countries, you will know that most times you just can't go to the hospital like that. You have to actually have a family doctor or a family physician or things like that. So you have a doctor or a couple of doctors who have an office that they see people and see patients. So you can work in offices like that for just one doctor that has his practice, or two doctors that came together and they have their practice. They're scattered everywhere. They're everywhere. So you don't necessarily have to be in the hospital, but you can actually be a secretary in a specialist's office. Emergency call handler. So people that have worked in customer service, this is for you. If you've been in customer service in the past, this is something that has actually equipped you with the communication skills to handle telephone. So with a couple of trainings, with a couple of practice, you should be able to transition into this particular role. But it will mean that you actually have a good command of whatever language is being spoken within that country that you are moving to be able to function in this role. So that might actually be a hindrance if you're spoken, let me now say English. Now if you're spoken English is either not as clear or not as pristine, you know, as they would have it. You know, for instance, you go to the US and you're going to a state that they are really like Texas, now that their tone is very you know, it's not easy to understand. So if you're speaking with this my accent, Nigerian accent, now they'll be like, hello, what are you talking about? Yeah. And the person is probably talking to you, telling you emergency stuff, and you yourself, you don't even know what the person is saying because the accent is just totally off. Do you get? So this might actually require you to be able to understand them as well as speak like them to be able to communicate effectively. But this is an area, if you're actually trained within the customer service space, you might want to look at. Then paramedic. I already spoke about paramedics, so I'm not going to talk about it again. So this is something that just requires training. You need to know how to give, you know, immediate help and assistance to people who have been involved in emergency accidents, rather, in emergency cases. So maybe there's an accident in a home or on the road, there's a shooting and stuff like that. You need to be able to give first aid and stuff like that. So you can actually have trainings and be able to work in this role. This is more or less like the highest paying role within this space. So if it's something that you want to think about, you're physically fit, you can actually think of gaining experience within this space and then, you know, going into it. Yeah. So for more formal or more specialized roles that require you to have a degree, you can be thinking of probably being a medical sales rep. So if you've had sales experience, or you have a marketing degree from Nigeria and you want to go to, for example, the UK, you can maybe read marketing or read maybe business administration or stuff like that, and then start taking certain courses within the medical space, right, that can actually help you launch yourself into probably a pharmaceutical company or a medical equipment manufacturing company that can help you become a medical sales rep. And I tell you, they actually earn a whole lot of money because it's a specialized role, right? You can want to become a health information technician. These are basically people who probably help to disseminate information to the public, because the public needs to know about what's happening. So for people that don't have related health background and you want to use a master's to launch into this, you can think of things like public health. You can think of things like healthcare management, leadership, innovation, and healthcare tech. These are areas that you don't necessarily need to have a degree or previous experience in healthcare, although it helps, you know, especially when you want to get into certain schools. But there are schools who offer conversion courses. So for instance, if you're coming from, like, I had a student who had English as their background and she got in for public health. There was no related education, no related work experience. However, she had related volunteering experience, and her motivation for wanting to transition was compelling. So the school actually went ahead and gave her a course in public health. And public health is actually something that is booming currently because, as you all know, Corona made everybody's eyes open to the fact that a pandemic can come in and everywhere will just scatter. You know, everybody will become handicapped and the world will slow down or practically even come to a halt because there is a disease that is just going around killing people. So what do public health specialists do? They can be consultants, they can be educationalists, they can work in different settings, both in hospitals, in government establishments, in private establishments. What they do is basically make research, disseminate information to the public, and ensure that people are doing what they're supposed to do to prevent them from having health crises, especially at a global scale. So that's a very good one if you actually want to get into it. I think I have actually spoken about most of the things I want to talk about. Yeah, I think I've spoken about most of the things I want to talk about, so I'm going to answer our questions now. This topic wasn't such a very robust topic, but I just wanted to open our eyes to the fact that when you're thinking medical, it's not just that you must be a clinical medical specialist. You can actually think of going into the medical sector, but in a different field, in whatever capacity. So if it's clinical, if it's the manufacturing bit, if it's the other services bit, and you can come in with your wealth of experience from other backgrounds such as accounting, finance, marketing, HR, administrative, you know. And if that is not even what you want, you can now learn some specialized skills that can help you get a job as a technician, as an assistant, you know, or, you know, front facing roles, you know, in medical establishments. So that's something that you can think of. So I'm going to go and answer the questions I already had. Okay, so Emeka Willia asks, how can in Nigeria switch to healthcare field from any other field? Now, Emeka, unfortunately, I'm going to say this, Nigeria is not a place where healthcare is so lucrative compared to other sectors, right? Especially when you don't have a, you know, degree in healthcare. So, but if you wanted to switch to healthcare field in Nigeria, is either you want to go back into school, you know, say you want to do nursing now, you have to actually go and do a 3-year course to become a registered nurse, or you can actually want to now switch into the administrative bit or other related healthcare companies. So you can work for a medical insurance company as an underwriter. You can work for health tech companies. You know, you can work for companies that sell medical equipment as a medical sales rep. You know, you can work in those capacities, right? So that is also still the healthcare industry. But if you want to go into clinical services, you might have to actually have a degree. But I will tell you that working in other related areas, such as what I just mentioned, in, you know, insurance companies or healthcare manufacturing companies or sales people that sell this equipment, actually is way more rewarding, you know, in terms of money, right? For you to actually earn well in the medical field in a hospital, you actually need to be a doctor or maybe a specialized nurse or something, or you work in HR in the hospital and, you know, you are being paid well. But, you know, I don't know, Nigerians don't value their medical professionals as much as they do in the outside world. But if you're able to get into a big hospital, then yeah. But if not, having a management science background in Nigeria, can you switch to health courses in the UK university? Yes, you can. So you can actually look at doing a course in public health, like I said. I don't know what management science. Oh, management science. Do you mean like political science? Do you mean like maybe economics? You know, finance and things like that? Is that management science? If that is it, you might need to look at a transition course, or you might need to look at other areas in the medical field. If you want to go into clinical services, you might want to dedicate a couple more years to actually study. But you can look at things like global health management and public health as a way to actually transition into healthcare. Okay, hello, can a human physiologist switch to nursing, and are there necessary exams to be taken? Yes, a human physiologist, yes, you can switch into nursing. I think that is even a very related course. So you can actually undertake a 2-year nursing course and you can become a registered nurse, at least I know in the UK. So yes, since you're already a physiologist, nursing is one way that you can go. It is a very lucrative field. Or you can actually even want to go for, you know, physiotherapy, human kinetics. You know, you can also want to go for occupational therapy. Those are also areas that are really, really lucrative as well, if not even more, because yes, you have more work opportunities in nursing. There are numerous. In fact, there's always space. There's constant space. You can never go out of a job. But these other areas I just talked about, they might not have as much opportunities, but they have equal opportunities. And when you enter into it, you're never going out because you're always going to be needed. So you can actually expand your choices if you so wish. But yes, you can actually go into nursing. You can. So do we have more? Let me see the time. I think I have about 3-4 minutes. Do we have more questions before I go? Do we have people who are looking to go into the medical field? Do we have people who are thinking that it was not possible in the past? Yes, it is possible. You just need to be determined, and you just need to determine which route you want to go with. You want to go with your master's in a health related course to help you launch yourself into the world of healthcare, or do you want to actually go with trainings that can actually help you get jobs that do not require certain university degrees to launch yourself into? However, you might need to actually go with a legal means to this country, and one of those legal means would be education. So even if you're studying a course that is not health related, you can as well do this other health related courses, health related certifications and courses that will launch you into the health space and eventually work your way up into becoming a well-respected and qualified healthcare practitioner. So yeah, so it's really possible. So for lack of questions, I think I'm just going to call it a day. If nobody has questions, I'm just going to call it a day today. So thank you all for coming. It's been wonderful talking to you. So if you actually want more information about this, just do well to send us a DM or go to our link in the bio to talk to any of our counselors. If you want to talk specifically to me, you can see my link on our bio, the one that says talk to the visa counselor, right? So anything that has visa counselor, just talk to me, or you can just send a DM and request for Rose. Or we have able-bodied counselors that can actually help you to make this particular decision, so you are covered if this is something that you're thinking about. So he said, do you have schools that accept intake for May, June for public health? So that I will need to check. Yeah, I think there should be a couple of schools, but usually public health is September. A couple of them might be for January, but it's more or less a September course. But there should be a couple of schools that might be accepting for May, June. So you will need to contact us so that a counselor can help you to check. Said, or adult nursing. So for adult nursing, you also need to have related background. So if you have maybe a related science background, maybe you did biochemistry or chemistry or lab tech, things like that, it's easy for you to actually get into adult nursing because it's a 2-year course. So it's like an abridged course that helps you get qualifications as an adult care nurse. So what you do is specialize in adult care as a nurse, not a carer. Yeah. So is Newcastle an ideal place to stay? Of course. Why shouldn't it be ideal? It's a very ideal place to stay if it's something that you are thinking of, or if you have friends and family already settled there and you're thinking of settling there. Fine, you can actually as well go to Newcastle. There's nothing wrong there. There are jobs, there are fun activities, there's a school there and stuff like that. So yes, you can actually think of going to Newcastle if you so wish. So do we have any more questions? Should I give a minute so that I can see if we have more questions before I end the live today? Do we have any more questions? Okay, so if we don't have questions, guys, I'm going to call it a day. So thank you all for coming. It's been wonderful having you guys here, and like I said, you can always reach out to us if you have more questions. We're always here to answer you, and we're always here to please you. So January session is available now. Contact us to put in your applications because some schools are actually already closed. As I'm talking to you now, some courses are closed. Some courses are closed, some schools are closed. So what that means is that the volume of applications that are coming in currently is overwhelming. In fact, a lot of schools, could not even handle their September application because it was voluminous. So they have now transferred most of the people that were not giving offers, or people that were giving offers but they were not giving a place at that particular course. They have transferred them to January. So you find that some courses for the January intake had just very little space. They accepted very little applications and then closed up the course, right? So if you're actually thinking of going for January, there's no time. This is a time to make a decision to want to make your application, or contact us so that we can start helping you gather your documents and put in these applications so that you can start on time, especially because of the short time frame. So it's already September by tomorrow, right? Yeah, so it's already September by tomorrow. So you have September, October, November, December. So when are you going to have your offer out? When are you going to make payments, especially if you want to use the Form A? You know, when are you going to get your bank statement ready for your cars? And then, you know, all the things that you have to do in preparation to getting your visa, then getting your visa and then traveling. The time frame is really, really small. So if you want to, if you're thinking of, and if you're ready to take action, then I suggest that you contact us now so that we can actually help you start your process ASAP so you don't miss out on January. Having said that, I'm going to say thank you very much for being here, and bye.